we
Right,
go.
well, good afternoon, everyone. Thank you for joining us today for the January session of the Carers Space Knots. Welcome to 2024. Today's session is going to focus on the updated information booklet for carers in Nottingham and Nottinghamshire, which has been co-produced by the county and city councils, the Integrated Care Board, and mainly carers themselves. The booklet contains a wide range of information and guidance, and James will be telling us all about it, and also how it was created and what the booklet will contain. Helen Yates will then introduce breakout groups to be led by carers, discussing hospital discharge led by Catherine and carers mental health led by Tammy. After which Helen will then give us feedback from the groups. And Sarah will tell us about involvement opportunities. Katie Adams and Helen will then tell us about Notts Healthcare Trust and carers' involvement. Before we get started, if I can ask everyone just to please keep their microphones on mute during the talks. The session will be recorded and will be available on the website for those that can't be with us today. If you do have any questions, if you could drop them in the chat and we can try and address them as we go through. If we don't get the chance to answer the questions or we're not sure of the answers, we'll do our best to find the answers and get them sent out via the mailing lists or put on our website. James and Helen will wind up by telling us about an app for carers and also in keeping in touch. If you think of something after the meeting, you're also welcome to contact us via email and we'll look into getting an answer to you. So if we could start, I'd like to hand over to James and the new Carers Information Booklet.
Thank you very much, Adrian. That's great. I'm just going to share my screen to put up a presentation. Can everybody see that okay?
Yeah.
Yeah, thank you.
Yes, thanks.
So just to start off, I wanted to briefly talk about the previous care information booklet, which you may or may not be familiar with. It looked like this, that's pictured on the right there, titled, "Do You Look After Someone?" And the booklet was designed really to help carers recognise that they're carers and inform them of the kind of support that's available for carers in Nottinghamshire. It contains information on support services, short breaks, safeguarding, support for the cared for person, and a variety of other topics. The booklet was made available online and paper copies could also be obtained and were often provided to GP surgeries so that they could be handed out when carers presented at the practice. And with the new carers service contracts coming into effect in October 2023, the booklet was in need of updating. With the booklet needing developing and the previous success of co-producing other documents with carers, including the new joint carers strategy for the city and county, it was felt that inviting carers to help co-produce the booklet would ensure that it's relevant and accessible for carers as possible. The opportunity to be involved in co-producing it was promoted via the Carers Space Knots mailing list and among other networks. And initially 11 carers volunteered to be involved in co-producing the booklet to the varying degrees that they felt were manageable for them. Since then, the group have been meeting online every 2 to 3 weeks to help design the booklet. And drafts have been shared with the group regularly via email to keep everybody up to speed and allow anybody that couldn't make meetings to update on that. And the Carers Space Knots members have also been going out into the community, visiting carers groups to get additional input for people that can't join online. In terms of the process of how we've designed the booklet so far, we used the old booklet as a starting point and looked through the existing sections and decided on those that we wanted to keep, some new ones that we wanted to add, or any that just needed changing. We considered the best way to order the sections to ensure that carers who are in need of immediate support can find that information quickly. As we got through the process, eventually each member of the group volunteered to draft or a new section or redraft one of the existing sections that they felt comfortable with. We then came together again and reviewed those draft sections and pulled them all together. This draft is currently with Notts County Council, who are helping to answer some queries that we had as a group and working on creating a sort of provisional design to show us how the finished product could look. In terms of what's included, this is a list of the contents as it stands at the moment. As you can see at the beginning, we have a section on if you need help immediately. The group liked the idea of having a sort of form here where carers could enter contact details of their own GP, social worker, some emergency contacts, and there just being a bit of advice of when to contact different services. Also on the front cover of the booklet, we would like to have out of hours phone numbers clearly visible as well for services in the city and county. In the Are You a Carer section, we chose to incorporate this graphic, which has been taken from the carer strategy, just because we felt this really clearly represented the breadth and the variety of situations really that carers can find themselves in, and make it as easy as possible for people to identify with being a carer and seek support. We also, following on from that, we have the support for the cared for person section, which includes information about assessing care and support needs, and among other advice. It was felt by the group that often the main concern of a carer is that the person they are looking after is getting the support they need, and that's why this has been positioned so near the front of the booklet. The group liked the idea of a sort of where to start checklist, which, for example, would ask a carer whether they've registered as a carer with their GP, had an initial conversation with the Carers Hub or the Young Carers Service, gotten an emergency card, and whether they've informed their employer, school, college, or university of their caring role, if that's applicable. Each of those checklist items would also show a page number to the relevant section, such as registering with your GP, which provides more info on how to do that and the potential benefits of doing so. Following on from the information on this section on assessing your needs as a carer and information, advice and support, there have been several new additions, including if you're juggling work and care, if you are in or interested in education, advocacy and legal aid, financial assessments and disability-related expenditure, and other local services for carers, which would include information on organisations like the Bradford Care Group, Community Coaching Company, Age UK, the Connect service, and some information on the Jointly app, which I'm going to be talking about a bit later. We've also added a section called Tips for Carers from Carers, which contains some helpful advice from experienced carers that may be of benefit to people who are new to the situation. And at the end of the booklet, alongside some empty notes pages, we're also exploring the idea of a sort of prompts list, which would help a carer prepare for conversations with adult social care, the Carers Hub, or other services, just giving them some things to think about that might come up in the discussions. And the two sections marked in red are those that Adrian mentioned, which we've not really got drafts for at the moment. And we'd really value your opinions on what you think should sit in those sections and how they should look. So that's a summary of the booklet so far. Can I hand over to you now, Helen?
Yes, thanks, James. Could you just, whilst I carry on, could you just send Dan Godley the Zoom link, please, because he can't find it.
Of course.
Thank you. Okay, so at the moment, the sections that James has just been through are with County Council in draft form, and we're going to be having their design team draw up some of those sections into a draft proof so that we can start to look at, as a group, with the co-production team, what it's actually going to look like. So there's a few things that we still need. So there's a couple of sections, they're the ones highlighted in red, that we don't have very much content for, which we'd love your help with this afternoon. And then also the other thing that we really need to start talking about is where this booklet needs to be so that carers can find it. So places to share it. So if you could have that in the back of your minds as well, then when we come back to discuss, it'd be a really good thing to hear from you all. Where does it need to go? How do we get this information out there to the right people in a way that they can find it? And there will be a digital version as well as a printed version, and the printed version will have a QR code on it to enable people to get to the digital version, and the digital version will be able to be kept more up to date than a printed version will. As most of you will be aware, it's obviously quicker to update links and things online than it is to reprint loads and loads of copies and get them distributed. But we'll be having dates written onto the booklet to say when it's due for a revision and when it's likely to be revised online as well. We'll have a timeline to it because we were all keen to make sure that everybody knows if they've got the most up-to-date information in front of them. So keep that in mind as well. So what we're going to do is we're going to give you a choice whether you would like to join a group to talk about hospital discharge or to talk about carers' mental health, in terms of what information needs to go into this booklet about each of those. So the group talking about hospitalisation will be led by Catherine. Catherine, can you give us a wave? There she is. And Adrian is going to help Catherine in that group. So he's going to be making sure that he's writing down what people are saying so that we've got the information to share afterwards. Thank you to Adrian. And the group talking about mental health will be led by Tammy. Tammy, give us a wave. There she is. And ably assisted by James in there. So there are teams. I will put the rooms up and you will be able to click on your preference. I thought that was the easiest way of doing it. I'm hoping that not everyone's going to go to one and not the other so that somebody ends up sitting on their own, but we'll see what you all decide. Thanks for that, everybody. So we've got a bit of time now to just feedback on what happened in the rooms, main points, things that we thought went well, things that we've heard from each other's groups, and anything that we want to add or ask or find out a bit more about as well. So, Catherine, are you okay to start us off?
Yeah, we had a very interesting and active conversation, which I think was very useful. And Dan came up with a great idea of, in the booklet, having a bit of a charter that we could ask hospitals to sign up to, so that it gave some salient points about, we were talking about medication, dressings, equipment, follow-up, have people got the right equipment, is there been an OT assessment? We learnt, Adele, joined us a little bit later, and she works at Kingsmill, and she explained, because we talked about hospitals having a checklist for discharge, and apparently there is one. So we're going to find out if that's accessible to the public on the website or whether it's just internal. But we talked about the need for a conversation rather than just a piece of paper that's given to you, because people receive information in different ways, and that actually involving the carers with the permission of the patient, if there's deemed to be capacity, could be very useful for everybody concerned. And of course, we would respect anybody's privacy, but often when you're being discharged, you're not in the best place. So even if you're deemed to have capacity, are you absorbing all of that information? And do carers need to know more? Because at the end of the day, we're the ones picking up what's following. So I think there's lots of useful information we can take from that. I don't know whether Dan and Adrian have anything else to add to that.
Sorry, I was just going to add. I know I can see Kate that's on the call, and there was a mention of was it you, Adrian, or somebody mentioned about a discharge from one of the mental health
Yeah, it was me.
hospital.
Yeah.
It was you, wasn't it, Catherine? Yeah. Obviously, Kate, you've got the triangle of care. And you know, so have you as a trust got discharge information as part of that triangle of care?
Yes, yeah,
Yeah.
there is a checklist again,
Yeah.
and it will probably reflect the conversation we had in our group, which is about the consistency of carers always getting that and knowing that it's
Information.
available.
Yes.
Yeah,
But I think it
that's
feels
what
like
we need.
in the in a handbook, it's useful to have that what you can expect type of
Yeah,
what you should be
I think that's
expecting
what-
to receive. Yeah.
Sure.
And links then to that information, because clearly in a booklet that's already several pages long, we can't put 30 pages of discharge, but there can be links to other information.
Yeah. So I don't know if that's on your website, Kate, and I asked Adele about Kingsmill, but obviously it wasn't her sort of main area as well. So I think that'd be good if we can get the links. If there is information on trusts' websites, you know, we can put that link in the booklet to that information.
Because with a checklist, somebody can think they've done their bit, but it's not necessarily the person receiving the information on the checklist knows it. So it's one person's view, isn't it? Perhaps rather than the reality and truth.
Okay,
Yeah, I
thanks.
think just to add, I think it was there was a lot of talk about joining up the services. There's very much a break between the actual discharge, but then also a picking up of the community services through the GP and how effective that link becomes. And if you're not careful and you don't get it right, then it tends to put people back in hospital, which is the concern and the thing you want to avoid, getting that support all the time.
Absolutely.
So can I add also, if you're going to put a link for the trust website, make sure it's a link to the actual page, because it's a minefield to trying to navigate around it.
Agreed,
Yeah,
Trevor.
absolutely, Trevor.
Absolutely.
Yeah.
Sharon,
Yeah, I just had a quick look on
Is
the on the Sherwood Forest Hospital website, and it's just a very brief detail about we do have a package, but it doesn't actually tell you what the checklist is or any
we can
detailed
perhaps try and get
information.
that. We have got some
A bit
contacts
more.
there, so
There's
yeah.
quite
Yeah.
a lot of information on the website. I'm just having a look, but yeah, and it's empowering people to know they can ask, because I think we're all in a bit of a flux when it's discharged from hospital. You're working hard to make sure somebody can come home safely. And you're not always thinking about everything, are you? We've not got that checklist, and that's probably what we need. And you know, unsafe discharge was mentioned, that actually it's unsafe discharge is clearly mentioned, or safe discharge on the website. So we need to, but people need to be empowered to understand what that means.
Yeah. Okay. We'll go to Sharon. Sharon's being very patient with us.
Thank you. Some of what I'm hearing sounds very alien to me in my experience over the last 2 years, being a carer for somebody who was alone with no family members, and I had to step into that, and actually the discharge didn't even recognise that she had a carer or needed that, and very often she was, you know, I got a call from her in a nightie and pyjamas, and she was sat in a wheelchair in A&E waiting for me to pick her up. You know, which so it seems quite alien that this is happening, and even though, you know, for that 2 years I consistently made sure that people who I spoke to, it was on the records, I was on the Dragon as a contact, when she went into hospital, I'd clearly said about a mild dementia and her being unable to retain and having a working memory very often and not understanding, you know, all of that was put out there and put in there, but it still wasn't necessarily recorded, and even if it was recorded, it still wasn't followed through. So I found that in discharge I was having to say, as an assessment been done, this person lives alone, this person's epileptic, this person, you know, so it feels like there's a lot of work to do, and maybe the booklet is a good way to bridge that, because if I'd have had this and that information and armed with that information, that would have been useful. But I think it still leaves me feeling like I would have still had to battle with that person at that time. And I think it's okay having them, but I just wonder whether the time capacity, or whether it's training, or even, I have to say, in some cases, attitude to other people questioning anything that was there. And so I'd like to know, does it on not just on discharge, but through every process when somebody's admitted, and particularly in A&E, because it seems there's hardly any records come back from A&E visits, you know, is it acknowledged? Is somebody asked whether they've got a carer? Is that then marked and flagged in a way? And does the triangle take account of that? Is it noted that, you know, this triangulation is part of the requirements? And is it noted that who that carer for that triangulation will be? Because for me, it feels like it's words, but it's not necessarily happening.
I think, Sharon, what you'll find is different places are at different stages of this journey, really, in terms of the triangle of care in NHS, and how to involve carers in what's going on. We can certainly carry on asking these questions, and we will. But and the information booklet will obviously, as you said, be a way of informing carers on what they are likely to be able to access in terms of information and support, and what they should expect at discharge. And the more information you've got, the better, because as we always say in these meetings, you don't know what you don't know. So that's where that comes from. I would imagine each hospital, perhaps even each ward, perhaps even each department, still has differing approaches to things. But obviously it's an ongoing piece of work, and we'll keep revisiting it, and it's all in part of the carer strategy that is still relevant, still new, relatively new, and still at the early stages of implementation in a lot of places.
Hey, would you know whether it's actually part of the audit? Whether they actually audit the checklists as part of, you know, because obviously each ward and each clinic all have data up about, you know, the different aspects of compliance and what they're doing. Is this one element that's part of that collection of evidence?
The first standard for the triangular care, and I've just posted it in the chat, is that carers and the essential role they play are identified at first contact or as soon as possible thereafter. So that's standard 1 of the triangle of care. And so that's the standard that we're working to. And within our record keeping, so within something called Rio or System 1, where patient records are kept, there are tabs and information places where that information can and should be logged. So it's absolutely front and center of the expectation of how we're working. So, and it's part of that self-assessment and that monitoring process moving forward. So again, I think putting into the handbook, what if an organisation says that they're accredited under triangular care, these are the expectations that carers should be having of their experience. And if they're not getting that experience, if that isn't being met, who can they talk to within a hospital or a trust in terms of seeing that being addressed? But yeah, so it's there. It's, as I say, front and center of what the triangle of standard 1.
Yeah, I appreciate that, but it's still putting the onus on the individual who's already a carer, who's already there to support the cared for person, to actually follow through. What I'm asking is, you know, what level is the accountability that is being done? So even to the point of, it's okay identifying the carer and making sure it's on the system, but is anybody actually monitoring the communications? You know, whether somebody's been informed about, or, you know, is that actually noted? Is that taken account of anywhere?
So we do monitoring around carers' involvement in things like care planning, discharge arrangements, but again, that's not across all the services that we run and all the services that we operate. So it's work in progress rather than consistently applied. But so really, the expectation is.
It just feels like really then the only accountability is for the carer to shout it when they're already in a position where they're fighting for the service, which, you know, from a quality standard point of view, doesn't feel like that's equitable.
Yeah, I guess it's also about the philosophy of how we want to work at the trust. The triangular care is about that philosophy of saying that care is about patients, their carer, and the clinical services, and that it's a three-way dialogue and conversation, and that's the philosophy behind it and the way that we want to be working as an organization. So we're all in this to make it work better than it is at the moment. So I don't think it's, I suppose I'm just reflecting, it's all on your shoulders as carers. It isn't. It's on all of our shoulders to see that triangle genuinely become how services are felt and delivered across, you know, not healthcare in our perspective, but I'm sure within those hospital trusts as well. So, yeah. Yeah.
Okay. Thank you. Peter.
Yes, so I wanted to come back to the point which I've made, which I don't think I've heard described yet, is that in the process of carers coping, what's happening to the person with the illness is changing as well. Medications are changing, the nature of and diagnosis of their conditions changing, and that creates yet a further aspect of the carer's mental health, because they thought they knew what was happening, and then they suddenly find that they seem to be going back to square one. So for me, it's making sure, as some other people have said already, that there is a clear link between the experience of the service user and the experience of the carer, and for people in providing care to be aware of that change is taking place in both.
Thank you, Peter. Pam?
It was just some of it's already been said, but I've recently been in A&E and carers weren't mentioned at all there, and I found I think a lot of people will find that their loved ones might come in alone to A&E as a first instance, and could technically be discharged without the thought of what happens then. So it's not just about them being admitted to a ward for a few days. You've got more chance of a carer becoming involved then, but almost less chance of a carer being picked up if they've had a fall outside or something and gone straight to A&E and been patched up almost. I've seen them trying to discharge quite confused elderly people at 3 a.m.
Yeah.
It was, yeah, it wasn't great. There was no discussions about carers, and it was quite concerning. So I think if carers are aware of what should be happening, as I said earlier, you know, if you know what they should be doing, you've got more awareness of your rights, that you can challenge that these things should be in place, so that you can stand up for things and say, you know, you're supposed to have this. So if there is some sort of checklist that you can pull people up on when you get to the hospital or whatever, and say, have you done this, that and the other, then you're more likely to get these things in place. But if carers don't know about them, you just kind of go along with it, and then it can lead to unsafe discharges when they're not really ready to go home, perhaps. So I think I keep going back to knowledge is power. If you don't know about it, you know, you just go along with it. But if you know about it, perhaps you've got a position then where you can challenge professionals.
Okay, so what we're gathering then is we need to get these or as much information as we can of these checklists for each of the different hospitals, so that we can include links to them within the booklet. So James and I can follow up on that with some contacts and see how far we get. And Dan, I'm sure the team at the ICS, our contacts there, will help with that as well, won't they?
Yeah, absolutely. Yeah, definitely. I know obviously Trevor and Catherine's just have put their hands up before me, but I just very quickly just want to say that there is that issue where Pam, like you've been in A&E, and if you've been kept in, you're in that, I can't remember what they call it now, but that area where you are not admitted, so you're still actually in A&E, but you're actually staying, like, is it assessment ward, is it? I think one of our health colleagues might be able to correct me. But yeah, so you're in that assessment unit, you're in that assessment ward, and then when you are sent home, i.e. discharge, people think, well, they've been admitted because they're in the assessment ward because they've stayed a couple of nights. That's a different experience to if somebody's actually on a medical ward, isn't it? So because they're not actually admitted, but obviously people think, well, they've been in a couple of nights, they're in hospital, and then all of a sudden they're saying, oh, you can go home now, Mr. So-and-so, Mrs. So-and-so, off you go. And maybe I think there's probably a gap there where, we've not got that, people haven't got that support.
Sorry, I know you've got other people got answers, but can I just come in to answer a little bit of that one?
Yeah.
So when a patient comes into hospital, they come into ED or emergency department.
Yeah.
Once they've left ED, so assessment unit, that is when they are classed as an admitted patient. So regardless of whether they stay on that assessment unit or go to a ward,
okay,
they should be treated exactly the same.
Right. Okay. Thanks for clarifying that, Adele.
Yes, fine.
Thank you.
Okay, thanks. We'll go to Trevor.
Yeah, just two things. I've just put a link in the chat room for a triangle of care standards. I did a video for the trust quite a while ago now, and it shows you all the standards there. And secondly, if you've got an handbook with all this information and all these tips that we can give the carer, they take it to the hospital or wherever they've got to go, and it's like an expectation. These are the rules basically, and this is what you expect. Can't we advise the person with the booklet in the hand to have two, so they can show the booklet to the nurse, doctor, psychiatrist, whoever they're talking to, so they can see a copy as well? Because we're wondering where to put these copies, and I've suggested on buses and supermarkets and charity shops and that type of thing. But how many copies are actually going into the hospitals, into the doctors, for the doctors, for the psychiatrists, for the nurses as well, basically? Are they getting that same information? And that gap could fill it up just by taking two copies with you. You've got one copy for this is the rule I'm talking about. Show them the page who you're talking to, and they can see what the trust is backing, and if there's any breakdown, we can actually bridge that kind of thing. It's just a way of actually continuing the conversation, instead of saying, oh yes, okay, leave it to me, I will look into it, and then you never hear a damn thing, so
it's a good point, Trevor. Actually, we've talked about how this is a booklet for care information for carers, but it's just as useful for professionals, isn't it?
Yeah, definitely.
It's got to be, isn't it? It's essential.
Well. Yeah, absolutely.
It's the other side of the coin, isn't it? Yeah.
So I think when we're talking about how it's promoted and marketed, we need to be very mindful of that.
Yeah, definitely.
Yeah, it's like an encyclopedia for everybody, isn't it?
Yeah,
works that way. Yeah, Catherine.
Yeah, all I want to say really is I think it's the lack of transparency, because we've talked about discharge checklists and things like triangle of care, but why aren't the professionals saying to the carers or to the patient or to both, we abide by this triangle of care, this is a copy of the triangle of care? Because people only know what they know, and it's the same with the discharge. If you're just doing a tick list, why isn't that conversation happening with people, that we have this checklist for you for discharge, and we want to make sure that we have done this, this and this, and how do you feel about that? It is the conversation and transparency, and unfortunately it isn't there.
Can I just say, if you look at that that video put in the chat room, there's a lot of information on that. But I did it on YouTube. I did it for the trust, and it's been up there for a number of years. I don't think it's on the trust website. It ought to be, but I'll leave that with Kate and whoever else can instigate that. Just take a copy of that and just look at it, basically.
Yeah, but people don't know it exists, Trevor. So
I know
if they're abiding by it, why aren't they saying, as part of the discharge or as part of when you come in, we are signed up to the triangle of care. This is where you can get a copy, or here's a copy. It's transparency. Anything can exist, but if you don't know it's there, it's neither use nor ornament, is it?
Well, that's true. That's true.
In theory,
there's no excuse when you got Google, is there?
Could we have, on the digital version of the booklet, could we have a link to a video, Dan? Yeah.
Yeah, absolutely. Yeah. So on the digital version of the booklet, you can put a link in, and obviously because it would be in PDF version, you'll be person that's opened the PDF. Any link that you've put in there, you can click on it and it'll open a web page or it'll open a video. So yeah, it's
that could be a nice feature then, couldn't it? We could have things like that in there.
You've got my permission to use that if you want to. It's up to
Thank you very much, Trevor.
Thank you, Trevor. Okay, we'll jump.
Sorry, can I just say one more thing, Helen?
Yeah.
It occurred to me that we need that joined up thinking with social care. It's not just about the carers, is it? It's that social care need to be involved in discharge, and there's often a confusion as whether social care will continue while somebody's in hospital. And I think there's a big thing missing there that we need to address before we go to print.
And I think as well, just, has social care been involved?
Yeah.
Have they spoken to the hospital social work team?
Just come to me now that we need that in the booklet somewhere.
Yeah.
Adrian, can you write that on the notes for the hospitalisation bit, please, about social care involvement, just so that we don't lose that? Yeah.
So just for clarity around Sherwood Forest then, we have a hub. So all our patients that are referred through to the hub, so any patient that has a need for something extra other than a discharge letter and they go home, they go through our discharge hub, and as part of that hub there is a social worker present, as are Age UK. So the social worker is involved. We'd like them to be more involved always in an acute hospital, but we don't get them in that often. But yes, they are.
Social care input. It didn't happen. I think it's whether people recognise it.
So social care may well have been asked for, but it's whether actually it's whether you tick the boxes, unfortunately, sometimes.
Yeah. And does anybody know the box has been ticked? Do you know what I mean? Again, it's the transparency, isn't it? That we don't know what you know unless you tell us.
Yeah, no, and I'm all for transparency. That isn't an issue, as I said earlier. I think it's difficult, as you said, your son had capacity. So sometimes it's difficult because we have to be careful we don't breach confidentiality. So it's that difficult conversation, isn't it? That sometimes you just need to go and say to whoever on the ward, I'm his next of kin, he's more than happy for me to have that information. And I get it. It's not the slickest.
Can you do process. A third party, like you do at GPs? Can there be a third party where your person you care for signs to say that you have access to information?
If you have capacity, you would be asked as the individual having the care, if somebody else approaches and says, can I have some information?
Yeah. No, I get that. Can they be pre-done like it is at GPs?
No, because it has to be at that time specific.
So there's not a third party arrangement.
No, there's not a third party arrangement.
Thank you.
Unless somebody lacks capacity, and then obviously we're looking at lasting power of attorney.
Right. Yeah. Thank you. I'm going to bring us back onto the mental health element of the booklet then. So Tammy, when in your discussions, was there anything that you'd like to share with the wider group?
We did actually go off on a little bit of a tangent and talked quite a bit again about the triangle of care, because of that having the biggest impact, or one of the biggest impacts on the carers' mental health, not understanding, not knowing, the frustrations of not being involved, not getting the information from the doctors, not being allowed to share information. So we did go off on a little bit of a tangent, in all fairness. But some of the things we did actually cover was the fact that it's really important that the carers are aware of their own mental health, their own well-being, and managing that themselves, and getting the help and the support from themselves. I used the term selfish in terms of, I know some carers don't like to do things because they feel they're actually being selfish because their needs are less significant than the ones that they care for. So they don't actually go and get help they need because they don't feel it's important compared to what others are going through. So it's more about the priority and seeing yourself as number one. So we focused a little bit on that. I mean, sorry, I've forgotten who it was that came up. I think it was Pam that used the analogy of the oxygen mask on the airplane, where they tell you to put the oxygen masks on others on yourself before helping others. Because obviously, if you're not being able to breathe yourself, you can't help others. So I think that was a good analogy to use and put forward. But we did go off on that little bit of a tangent in terms of the triangle of care and assessment, and the impact of that on the carer.
Thank you, Tammy. Okay, that sounds like it was another good conversation as well. So thank you everybody for your input, because we will be putting these areas together into these categories for the booklet, and then obviously adding it to the other sections that are already underway,
drafted,
yeah, and ongoing. Okay, so thank you ever so much for your help with that. We have got 15 minutes. We've got quite a few things left on our agenda this afternoon, so we will try and get through as much of it as we can. The next thing to talk about was to share opportunities for involvement with you all. So there are a few things that are coming up that you're able to get involved in as carers, and Kate is also going to speak about some involvement opportunities that they've got in terms of the triangle of care work that she'd like to speak to you about. And then I do still want, if we can, to give James some time on jointly, so we'll see how we go for the next few minutes. So as far as more general involvement opportunities, we have got, at the moment, Trevor and I are starting up some work around the Carers Roadshows. So what we are aiming to do, and I will get some dates in the diary, Trevor, is to have some meetings in different parts of the county where carers who are interested can come along and talk to us and talk with us about setting up roadshows in their local area. So we've got working groups in different parts of the county and one in the city as well, so that we can look at how the roadshows are going to work over the next year or so. So if anybody here is interested in that or being involved in that, then please get in touch with us, either through the Carers Space email or directly with Trevor or myself, and we'll make sure that you're invited to a meeting near you. So that will be upcoming. We're very excited about that, aren't we, Trevor, about getting everybody involved?
Yes, very much so. And I think we're going to gel in the big conversation as well, so we can actually, pull them both in so they'd be related as well. Not stopping anything, keep everything going, but also relate them together as well.
Absolutely. We want to hear what people want and what they need and how things are working for them as well. Brilliant. Yeah. Thank you, Sharon. That's great. Sharon's interested in getting involved with the roadshow. Fabulous.
Brilliant, Sharon. Yeah, send me an email.
Okay. And other opportunities we've got as well. Dan, there'll be some coming up regarding short breaks, won't there, for people to get involved in?
Yeah.
Do you want to elaborate on that a little bit?
So we've teamed up with partners, Social Care Futures, as part. We put a bid in actually to get them to take forward a Working Together for Change event, but also they will do quite a bit of the work and do a report with some recommendations out of that. So we are picking up the review around short breaks this year. As obviously as part of that implementation of the carer strategy. So this particular project is looking at primarily some of the background and some of the processes and that how it's offered. It's not about the capacity of services. It is about actually, if you've got a short breaks allocation budget, how that works. So they term it as the plumbing and wiring, it's a good analogy really of the processes. So so we've got a kick-off meeting next week, but that's just like the reference group. So but there will be 2 workshops around that, and there'll be those working together for change type events. So people that's been involved with those sorts of things before in the past with Sarah Craggs and Mike Deakin, they'll be familiar with that sort of format. So if you're interested in any of that, then either go through the the Carer Space website or contact me directly, and as soon as we've got the dates for those workshops, I will let you know. But that's a good opportunity to influence the change around some of the processes and systems that sit behind when we offer short breaks as a part of a package of support for someone.
Thanks, Dan. I'm going to hand over to Kate. There are a couple of others opportunities for involvement, but I will make sure they're shared via the website and social media and through the Carer Space email address with you. I just want to make sure Kate has time to speak.
No. Yeah, thanks.
She needs to as well. Okay.
Yeah, no, thanks ever so much. It feels really topical as well because just to introduce you, my name's Kate Adams. I work for Notts Healthcare Trust in the involvement experience volunteering team. So I work with Paul Sanguinazzi, that some of you may have met and known for a period of time. And one of the pieces of work that I'm leading on for the trust is around our triangle of care self-assessment process, and it's more than that. It's not just doing the self-assessment, it's thinking about, so what do we need to do, what's the actions we need to take, what's the information telling us, how do we keep this a very live conversation with all of our local teams. So just to share, we did this year we've had 151 of our local teams do a triangle of care self-assessment, and that's across all of the divisions that we have within the trust. So we've got our mental health teams, we've got our forensic services, so from Rampton into our providing healthcare in prisons, and we've got our community-based teams, so that's district nursing, community rehab. So we've got 151 self-assessments where teams locally have been sharing what are they doing around those 6 standards, and they do an assessment about what are we doing okay on, and where are we not doing quite so good. And we ask for evidence that provides leaflets or information, or how do they prove that they're collecting at that early stages care information, which links to some of the conversation Pam we were having earlier on. And what I'm coming to ask to you, and I've connected up with Helen and Dan about, is we'd really appreciate if some of you have got some time to do some review of some of those self-assessments within those teams to provide your sense check of whether or not that feels like the experience you've had, or when you've read what people have said, whether or not you feel that's a good enough evidence of how people are supporting and working with carers in their local services. So my ask would be, if any of you are interested in doing, we called it peer review, so some carer peer review of our triangle of care self-assessments, we'd be really keen to work with you on it. We've got a couple of hours of a workshop that we've put together that talks in detail about what is triangular care, what would good look like, what are we aiming at as a trust, so that you know what we're looking for. And then what we'd like to be able to do is to share some of those self-assessments for you to give the feedback, and we've got a template that you could fill in. We could do that as a group, we can do that individually, we could look at a particular set of wards, or we could look at a whole scattering of the assessments have come through. Key thing for me is about hearing that carer's voice and us being able to then share locally with teams what that feedback it looks like, and what your comments and thoughts have been, to build that local action plan of what next, what are people going to be focusing on over this next little while. I'm going to put in the chat some more information so that you can have a look at what our ask is, and there's a contact at the bottom of that document that I'm going to put in there, where you can come back to me, or you could come back to Helen, just to have a bit more conversation. And Helen and I are going to have a chat as well to see, is there any way that we could do some of this triangle of care work with other carers across Nottinghamshire, so that we can share what we're aiming at, but where we're at this moment in time as well. So my ask is, if any of you are interested, it would be great to get you on board and signed up and working with us on doing some of that peer review.
Thank you, Kate. We'll put all of that out to the wider mailing list as well, so we'll make sure that that information gets shared. Trevor.
I don't know if Paul told you, Kay, when we first did these reviews for Triangle of Care, we got, I think we got 11 to do, and we had a 2-hour get together with the carers, and we got through 2. So be prepared.
Yeah,
it's a long haul, and I don't think 2 hours is really going to cut it. But
no.
That's just. But Paul will know what I'm talking about anyway.
Yeah. No, I totally agree. And the 2 hours would be an ask to come along to a workshop where we share all of what is triangular care, what we're aiming for.
Yeah.
And then on top of that, we'd ask you to have a look at 2 or 3 self-assessments. But we want to work with carers where, if they've got a particular area that they're interested in, but not it's I was going to use a MESOP wards, but the older people wards or dementia wards, or whether or not it's particularly interested in some of our mental health services at Rampton, for example. If you've got a particular area that you're interested in, we could share those reviews with you to provide some feedback, rather than looking at something that you're not interested in or doesn't have any resonance with your experience. But we recognize it's quite a big ask. And so that's why we're coming to you and seeing what you might be able to do.
Plus the fact you'll have a bigger audience if you went to Rampton.
Made complaints. So we thought that was an audience who probably has got some really useful feedback to give to us, and perhaps is an audience who we don't ask very often, but we're putting the ask out through our PALS team to see if anybody who's been in that complaints, whether or not they might be interested in coming through and doing some of the peer review with us. But genuinely wanting to refresh how we work, how we operate, and to put that triangle of care front and centre of our approach to the way that we deliver care. And I know, I've heard already today where that's not quite your experiences, and we know that we've got some work to do about it. You'll have seen some of the press coverage that we've had, but we have to, we've got lots that we can do. There are lots of great things to celebrate, but there's lots still to do in terms of making that a consistent experience across all the services we run. So great to have you with us.
I do appreciate Rampton are caught between the CQC and the Home Office, and they both talk in different languages, and it's hard to run that place. I do agree, but it was Rampton where we got the confidentiality from a phone call from a carer asking for the collar size of their loved one, and it said, "Sorry, that's confidential. Put the phone down." And that started the confidentiality store, and then we went into Triangular Care, which was already running. We pulled it into the trust, but that's a historical thing, that is.
No, we're working on the shoulders of what's gone before to say, and it's brilliant. 151 teams across this trust.
Absolutely awesome, that is.
Have the conversations about how are we doing with our carers.
Yeah, we had 10. We had 10. 150 is huge progress.
It is, but there's still a lot to do. So I don't want to take any more of your time.
Thank you.
Okay, thank you.
Helen, I'll leave it some more, or think about how else we might be able to get involved. Thank you.
Absolutely. Okay, thank you. Right, we are fast approaching 3 o'clock. We haven't spoken about jointly. What I would like to suggest, James, I'm looking at you because you're the one who's going to have to do the work on this one for me, is that we try and put on another session within the next couple of weeks that is just on jointly, and we can open it out. We can advertise it via the Carers Hub as well, and see if there are any other carers who want to come and find out about jointly, what it is and how it works, because it is an app that can be accessed by carers for free at the moment through the county council, so it would be worthwhile if we can do that pretty soon. So that's what I'd like to suggest we do with that bit. And everything else we'll communicate via the normal routes through the email network as well with everybody, and we'll put this video up online shortly. But I would like to thank everyone for their input with the booklet, and for being here today and finding out about how that booklet's being put together. It is taking longer than anticipated, but I think it's going to be a really useful piece of information, and we will get it. We'll keep you updated on its progress as we're going through, and the group, those of you who are involved in that group, thank you very much for being here today and supporting with this conversation as well. Okay, is any questions from anybody just before we finish?
Great meeting, I enjoyed it.
Thank you, Trevor. Lovely. It's lovely to see everybody. And
Yes.
yeah, you know where we are. Just get in touch.
Thank you.
Thank you.
Okay.
Thank you.
Thanks.
Bye.
Bye bye.
Bye.
Bye bye everyone. Bye bye.